Good afternoon. I'm George Latimer, Westchester County Executive. It is Monday, January 24th, 2022. This is our weekly Westchester update covering issues related to COVID and some of the other things that are happening both in the county and across the county and some of our municipalities. We're going to be joined today in a few minutes by the mayor of the village of Ossining, Rika Levin, who is our guest this event. We try to do this every week with a different elected official, chief elected official from one of our many municipalities to come and talk a little bit about what's happening in their community. Some of it may relate to COVID, some of it may relate to other issues. Last week we had Mayor Tom Roach of White Plains, so very happy to have Mayor Levin with us here today. And of course, Deputy County Executive Ken Jenkins will be joining me as part of the update as well as we go through some of these key issues. First, let me get you up to date on where we are at this moment in time with Westchester County's COVID infection numbers. The tracker from New York State that we use to identify what we're told are the accurate figures show us that through Sunday, we have 13,309 active cases of coronavirus. That's on the basis of having 238,000 people pandemic to date having tested positive, and 225,000 of those individuals have reached the 10-day or more period. Most of these folks are long since recovered from having the disease. And so once we get to the 10-day point, the number of active cases are the number of people that have been tested in the last 10 days and were tested positive and have not gone through that protocol. And then we also add back in those individuals who are still hospitalized. And then, of course, those who we've lost through fatalities ultimately are the ultimate statistic that is the sign of our failure to be able to stop this pandemic and the number of people we've lost. So at 13,309 active cases today, that number is down dramatically from where we were just a couple of weeks ago. We reached the Omicron peak just about 2 weeks ago when we hit 36,000 cases, 36,345 cases was the peak number of individuals infected, active cases at any one time. So we're down now, not quite, but approaching 2/3 of that, which is an impressive reduction. But the increase in cases was really huge, well beyond whatever we saw before. Our maximum number of infected cases at any point in time under the previous Alpha and Delta variants was about 12,000. So to be at 13,000, we're on the way back down from 36. That's good news. The trend line is clearly a plus. This is what was reflected in the news we got from Europe and from South Africa about the Omicron variant, which is that it is highly contagious, but it does not have the same depth of impact on people, particularly when they're vaccinated. So we're seeing that also play out in some of the indicators. But we are now 3 weeks past New Year's, and as we anticipated and came true, as we approach the Halloween, Thanksgiving, Hanukkah, Christmas, and New Year period of time, we saw, as we did a year ago, a rise in the number of active cases. And now that we're a couple of weeks after New Year's Eve, we see the decrease. As has been stated many times, for as much as we do in the public domain, the number of meetings that we change from in-person to Zoom, the mask mandate that exists as established by the governor, the efforts to vaccinate people, various other restrictions that may be in place or other considerations, most of the spread of this disease comes in what's called the living room setting, in your personal interactions with friends and family members, for which government policy does not reach into your living room or at your dining room table to try to reduce the spread by the actions you take or don't take. We do try to attack this in the public sphere, and that's why you have some of the issues you have now in schools and in other settings. The number of people who are hospitalized as of the last number, that number we have most recently as of Saturday, that's 486 individuals that are hospitalized right now for coronavirus. That number has come down from a peak of 627 cases, which existed about 10 days ago. That was the high water mark of the number of people in this cycle that have been hospitalized. So to go from 627 down to 486 is good news. Again, good direction. The concern that communities have is when the number of people hospitalized exceeds the number of beds, hospital beds available within that area. Now, Westchester, as I've often said, is not an island. We're adjacent to other places with hospital capacity. But for Westchester alone, we have approximately 2,700 hospital beds. So to have 486 hospitalized is a serious number. but it does not approach taxing what our infrastructure of hospital beds can accommodate. And the number of ICU beds right now is at 160, and we're told that we are not maxed out on the number of ICU beds at this point. There's still available beds to deal with that. So that is another good sign that while the infection rates have been very high, the severity of the infections have been very much reduced over prior circumstances. We've had more people affected by COVID this year than we had a year ago in the end of the 2020 into 2021 year, but fortunately we did not reach the peak equal to what happened in the initial outbreak of March and April of 2020, in which we had a very high number of people infected, and even more importantly, we had the highest amount of fatalities concentrated in a period of time at that initial outbreak. We have not seen that at this stage of the game. However, the number of fatalities have jumped up. We had 7 people who died during the total month of November. We had 60 people die during the month of December. As we stand now with statistics 22 days into the month, 3 weeks, almost 75% of the month, we have had approximately 160 people die of COVID this month. So we've gone from 7 to 60 to 160 without that being a full month. That does reflect that many of the people that get COVID who are unvaccinated are unable to fight off the disease any more than people who, in the pre-vaccination period of time, contracted COVID. So the peak fatalities that we had came before vaccinations came on board. Vaccinations came on board a little over a year ago. The amount of fatalities have dropped dramatically, but the unfortunate reality of those that are unvaccinated, and to some extent those who are vaccinated, who have an underlying health consideration or are of advanced age, those individuals are also very vulnerable to this disease, and we have seen fatalities that track that number over the course of time. We're hopeful that what we've seen overseas will also be fully manifest here, which will be a significant drop in the number of hospitalizations, not only as we get further away from a holiday, but as we get a little closer to the spring and the better weather. We're still in the heart of the winter. We're going to be in the heart of the winter for at least another roughly 60 days, maybe if we're lucky a little less than that, 45 days perhaps. But as long as the weather is cold, we tend to do more things indoors. And the more indoors we are, the more the disease is communicable in that kind of a setting. But the numbers themselves, when you want to just look at what's the positivity rate, what's the infection rate for the day before yesterday was 7.5%. To put it into perspective, in the day before Christmas, as we saw the increase in the Omicron impacted cases, we were at a 12.6% infection rate. That means out of every 100 people, excuse me, out of every 100 people that were tested yesterday, and we had over 10,000 people tested yesterday, out of every 100 people tested, we had 7.5 people test positive for COVID. When we had that same 100 people test just before Christmas, it was at 12%. And that number is actually higher than that at various other dates. But just to give you a comparison, so the percentage of infections go down, and on any given day, the less number of people we have infected on that day compared to the greater number of people that were infected 10 days ago that are now off of protocol, that's what drops our active case load from day to day. As you track on our dashboard, we try to keep that updated for Westchester. We report the information that we're given from the state of New York. The state of New York collects data from hospitals, nursing homes, all testing entities, all report to the state. The state returns that information to us. We provide it on the dashboard, and then, I synopsize it here when we do these weekly updates. Now, as I mentioned in the last couple of updates, we have asked the state for additional information. We've asked them for hard numbers on vaccinated, unvaccinated. We've asked them for percentage of vaccination numbers, those above the age of 18 and those below the age of 18. We've asked for information about vaccinations, not just for the first 2 doses, but for the 3rd dose. They have been commonly called booster shots. We treat them as the 3rd necessary dose to be fully vaccinated. If you are fully vaccinated, you have had 3 doses of Moderna or Pfizer. J&J would take 2 doses because 1 dose in the front end and then 1 dose at the 6-month interval. And we may very well find that to be fully inoculated will require an annual dose of a COVID vaccination. Medical science will have to tell us that. But at this stage of the game, our numbers for the first dose and the second dose are very high. 85% 2 doses, 90+% for 1 dose. But that 3rd dose is what we have to raise up, and that's why we put energy and effort into making sure that vaccinations are easily available to people all across the county. We're going to stop that portion of the update. We have more to report on it, but I want to introduce our guest, the mayor of Ossining Village. Rika Levin became mayor in 2021 when she was elected to a 2-year term as a village mayor. She served previously 5 years as a village trustee. Those are also 2-year terms. Now, Ossining Village is the largest portion of the town of Ossining. That's not true in every town. Sometimes the town outside the village is the larger portion. But in Ossining, the village of Ossining, which is what you think of when you think of Ossining, where the Ossining train station is, where Sing Sing is, where the clock is on Church Street and that Route 9 corridor and going down Main Street, that is the village of Ossining. The corporate limits of the town of Ossining extend further to the north, further to the south, and then further to the east. We've got the Hudson River, beautiful Hudson River to the west. Rika has a professional background doing a number of different things in management positions. She's currently the managing director for a major not-for-profit organization based here in Westchester County, in fact, based down county, so she's got a good flavor and taste of the totality of the county, her home community, and then where else she travels and works. So we're very happy to have her back. She was here once before, I think right early in her term, and she will give us an update of what's happening in the village of Ossining. The mayor of Ossining Village, Rika Levin. Thank you for coming.
Thank you. Good afternoon, everyone. Let me start from a place of gratitude, first of all, to the County Executive, George Latimer, my friend Ken Jenkins as well. Thank you for having me here. It is always a pleasure to talk about Ossining. It is a beautiful place that my husband and I moved to many, many years ago. And I wouldn't want to live anywhere else. So, and I do work, and I go all over the county, and I still say those exact same words. Under every situation. I wanted to also go to a place of gratitude for our first responders in Ossining, but specifically OVAC. The Ossining Volunteer Ambulatory Corps has done a Herculean job of addressing the pandemic. As the county executive said, we can only do public policy at the government level to help when things happen. I wish we could prevent all of the pandemic from spreading. We hope that every individual takes that upon themselves in the most healthy and proactive manner. But we do the public policy as much as we can. So let me give you a little shout out with some numbers for OVAC. So 11,000 free, let me repeat the word free again and again if I can, vaccination were completed in the past 3 months. 1,500 we're grateful the county has supplied, and other government agencies have helped us in being able to give 11,000 free vaccination, 8,000 tests, most of which were done, as the account executive again said, during this major holiday season. So most of those 8,000 tests were done really in about 2 weeks' time. They're still being done. Still going free of charge. Our first responders, our police, our volunteer fire department, which is one of the largest in the state of New York, when they need to be tested, when they need vaccinations, they also go to OVAC. So do, and I contact the superintendent over the weekend, over 500 families on a regular basis from our school system are going to get it down. So a shout out to OVAC. It is a model, and I would recommend it as a model for every municipality in Westchester in the way they work. They work around the clock. They are volunteers. I am hopeful that as we get through this pandemic, that we may look at either the county or state level to look at that model and maybe give them some more support, because they are the only group of first responders that really don't have the coverage, the benefits, and the training, et cetera, that some of our other first responders get. So that would be something that I'm learning through the pandemic, learning a lot of things. Didn't know I was going to be called the pandemic mayor until I went to a meeting this weekend, but apparently I'm now the pandemic mayor. I'm okay with that, because part of what civil service is about, part of what I run to be, and I think all of my colleagues who are mayors, I hear Tom Roach was here, really, what is our role? Our role is to help people have better lives in the communities that we serve. Right now it's a pandemic, another time it'll be some other issue, good and bad. I also wanted to move not just about the pandemic and the learnings, but in the middle of a pandemic, as our village management really deals with all of the issues, both our staff, the police, fire, and everybody in the community, we've gotten a lot done. I mean, I'm going to just say, we have gotten so much done. We have won, thankful to the state and Governor Hochul, the DRI award for $10 million for our community, along with our neighbors across the Hudson. We have kicked off our meetings 2-3 weeks ago, developing all of the next steps. So in the next 6 months, we should really see some traction as to community engagement and the major infrastructure changes that is long overdue in a village like Ossining, with over 27,000 residents, businesses, and a growing downtown. We're also looking at proactively managing our flooding zones. We are on the Hudson, and I do mean that literally, where if you look from a plane, we're like on the side of a cliff right into the Hudson River. We are a huge environmentally conscious village. We've always been that way, and we will continue to be that way. We're always looking for proactive development in our both infrastructure and flood zones in order to do better development. We are looking at affordable housing and are building and approved unanimously to move forward with a 109 unit on the waterfront by the train station. So it's good for commutation and mobility, for affordable mixed housing, all affordable and within that mixed income. And we are also looking to improve our community center, which is for me, personally, my number one criteria, because community centers, more than any other institution anywhere, is the place of total equitable outreach for every member of our community and from outside of our community. But most importantly, it works with the schools, it works with after-school programs. It has been used to the nth degree during this pandemic, and we are going to, through the DRI and other matching grants from, we hope from the county, we know from the state, we'll do some match funding for after school, opened it up 7 days a week, thanks to the union for agreeing to that. And those are some of the key elements. I named about 5 of them. Super proud of all the work that we're doing, and I know you're going to hear more. So I thank you again, gentlemen, for having me here, and I thank you for the time.
Thank you very much again, Rika Levin, the mayor of the village of Ossining, and we thank her and the members of her village board for their leadership alongside the town of Ossining. Also within the town of Ossining is the village of Briarcliff Manor, so together they've done a great job. We look forward to continue to working with them. In fact, this afternoon at 3:30, we have our twice monthly municipal call in which we interact with the mayors and the supervisors of all of the communities of Westchester, those that participate, and we share information with those local governments on these issues. So we'll probably talk to Mayor Levin then once again. So back on the countywide COVID information, a few facts. The county health department is now offering our vaccines in both White Plains and Yonkers, and also PCR tests at the county center, and these are all done at separate times throughout the rest of the month of January and throughout the month of February. There are second doses and third doses, booster shots, that have been made available to all of these things, and it's broken down into different component pieces. We will post all of them on the social media. You may see some of them on the screen as you're watching us. COVID-19 vaccines at the county center in White Plains. It's afternoons by appointment only from Wednesday through Friday. It's also available on Saturdays from 10 a.m. to 2 p.m. So it's in the afternoons, Wednesday, Thursday, Friday, at the county center in White Plains. These are vaccines, and you have all of the different information about Pfizer, Moderna, first, second doses, Johnson & Johnson, and so forth. The COVID vaccines at the Westchester County Health Department, which is at our clinic based in Yonkers on South Broadway, these are available on Monday from 4 to 7 p.m., and our location is 20 South Broadway on the second floor. Appointments are encouraged, but at that location, walk-ins can be accommodated, and this again will extend through the rest of January and the month of February, with one exception, and that's President's Day, which is February 21st. There'll be no clinic on that day. Again, all of this information will be posted on social media, and you can take a look to see where you fit in by the different type of vaccine that you received and where you are in your cohort. Our PCR tests, those are the tests that involves getting swabs from your nose, is available at the county center, same period of time, rest of January, all of February. There's new appointments added every 3 days. You have to go online to make the appointment. You must have an appointment for this, and it gives you different times on different days. Mondays and Tuesdays, it's 8 to 4. On Wednesdays, it's 8 to 12. On Thursdays, it's 8 to 2, and on Fridays, 8 to 12. We don't do this to confuse you, but we make it available at various times, so if you can only get away during your lunch hour and you're in the area, you know which days we have it running a little bit later on Mondays, Tuesdays, and Thursdays. It goes as late as 4 o'clock at the beginning of the week, and 8 o'clock starts in all of these locations. But the tests, the PCR tests, are targeted for those individuals who have symptoms. So you have a runny nose, you have a fever, you have those types of things that lend you to believe you have COVID, and you've been exposed, or you have been exposed to someone who tested positive for COVID-19. Those results will be ready within 3 days to get that information to you. The appointments are required. There's a place you have to go to create an account. Hopefully we're showing it on the screen. You should bring a driver's license or other photo ID when you come. And for accurate results, do not brush your teeth or use mouthwash an hour before the test. Do not smoke, vape, eat, or drink, chew gum, mints, or lozenges for 30 minutes prior. All of those things will affect the outcome of your test. This is not mom telling you how you have to behave. This is making sure that you get an accurate read on the test by not having those things. And do bring your driver's license or other photo IDs. So again, Westchester County Center, available for vaccines and available for PCR testing. Our clinic in Yonkers, 20 South Broadway, available for vaccinations. Now Ken Jenkins will talk about our satellite locations, some of the different places that represent a temporary but very valid place to get your vaccinations. Ken.
Thanks, George. And certainly it's the combination, as County Executive Latimer has pointed out, between all of the availability between vaccinations, testing, and ensuring that people are boosted appropriately, and more importantly, going to the place where your shot regimen depends on if you had Johnson & Johnson, which is a 2-shot regimen to be fully vaccinated, or in the case of Moderna or Pfizer, it's the 3-shot regimen to ensure that you are fully vaccinated. We have this week on the 25th, the second doses at 2 of our satellite locations with our partners in the education systems. In Croton at the Carrie Tompkins Elementary School gym, that's the second doses for those folks that had their first dose a little bit earlier in the year. From 2:45 p.m. to 6:45 p.m. and at the Columbus School in New Rochelle tomorrow, again on the 25th, from 3:30 to 7 p.m. Thursday and Friday, we will continue our pediatric clinics in White Plains. As County Executive pointed out, there's vaccinations being given at different times than the testing at the county center in different areas of the county center, which is why it was great. The County Executive made that available to partner with New York State. That gives us the supplies, but the Department of Health and our partners in our contract vendor helps us throughout those particular facilities. Thursdays and Fridays, it's recurring. Thursdays and Fridays, 3:30 to 6:30 on Thursday, and on Friday, 2:30 to 6 p.m. And again, I'm going to the county website to be able to make appointments for those places in the county center. At the elementary schools, and again, shout out to in Ossining, certainly Ray Sanchez and the folks in the Ossining School District and all the superintendents. Again, the county executive's leadership has been evident from the very beginning of this pandemic, when there has been conversations with the school superintendents throughout the pandemic, including a weekly conversation to ensure that whatever information that we have, we can continue to give. Finally, we have food assistance available for those individuals that under isolation for COVID, and again, that means you tested positive and you are in isolation. Now, the contact tracing is not being done the same way at all anymore throughout the state of New York and around the country. But again, if you test positive, you have to follow those isolation guidelines, and that may mean that you need additional assistance for food while you're in isolation. Call for our COVID hotline there for that, for food assistance, 914-995-5566, Monday through Friday, 9 to 5, and that is available to anyone as long as it's under isolation for COVID activities. Again, we thank all of our partners that have been engaged and involved with us at the federal, the state, and the local levels to ensure that we are able to provide all of these opportunities, whether it's vaccinations for pediatric, testing, regular vaccinations, boosters or third shots, food assistance, rental assistance, and all those kind of things. And we need to continue this work so we can get through this crisis together as the cases continue to go down. Thanks, George.
Thanks very much, Ken. We're going to touch on a couple of other topics while we have the moment to give you an update. We've talked a lot about the circumstances for tenants who face eviction. They've been unable to pay rent over some extended period of time due to COVID. The state and the federal government have created programs to help assist in that, funded by the federal government, to some degree funded by the state. The Emergency Rental Assistance Program, there's always an acronym, that's called ERAP. That is now officially closed. So for those of you that filed under the ERAP program, the claims are being processed. There's a significant amount of money set aside to resolve those issues. When they are resolved, the landlords receive direct funding that will help alleviate some, if not all, of the back rent that's owed, and those tenants maintain their tenancy, but they have to be responsible, as we all are, for paying their bills month to month going forward. There may be other reasons why people have difficulty paying their rent, but this program was established by the federal government, state government, to deal with COVID-related loss of income. And COVID, of course, while it's still with us, is not in the same crisis mode as we saw back in the early part of 2020 when the whole society was shut down by various government authorities. We have not had an across-the-board shutdown of industries as we did almost 2 years ago. And so hopefully we'll see that opportunity for people to avoid by gainful employment facing these kind of problems once we can catch them up. However, even though the ERAP program has closed, there is still help out there. And the most important thing to do, if you are a rental tenant and you have received a victim notice, is not to sit on that notice. You need to reach out looking for assistance. You can contact us here in the county through the DSS department at 995-3333. There's a place to apply for online benefits as well. But it can help connect you to people who are experienced in this area and can provide you the advice and the direction where you can go to still get help of a different format, different structure. DSS has several programs that offer eviction prevention assistance for the low to very low income families and individuals. That's $30,000 less or a year in terms of income. That's when you call the DSS offices. They can provide some information. If you don't qualify, DSS can then refer you elsewhere. The Department of Planning has rental eviction assistance through Emergency Solutions Grant funding, and this is for those that are in consortium communities. There are a number of communities that have joined the Urban County Consortium. The major 4 cities have their own CDBG grant programs. Many of the rest, but not all of the rest, have joined the Urban County Consortium program. So if you're in a consortium community, if you don't know, you'll call our planning department or contact us. You can call us here generally at 995-2900. We can connect you to the information you need to determine if you're eligible for ESGV-CV funding. Cases are reviewed. Funding is distributed through various non-for-profit community partners: Community Housing Innovations, Washingtonville Housing Alliance, Choice of New Rochelle, and Westchester Residential Opportunities. Those are all not-for-profit organizations that specialize in helping tenants deal with housing-related issues. Eligible applicants have to be within 21 days of eviction. They're at 50% or below the area median income. For family of 4, that's $63,000. For more information, you can go online, visit the Department of Planning. But as I said before, if all else fails, call 995-2900. We have individuals who are ready to chat with you in our constituent support office, and they'll be able to get you to the right people that you need to have. But whatever you do, do not assume it's going to resolve itself. Do not assume it's going to be automatically waved away. If you get a notice of eviction, respond to that notice in a proper fashion. Seek some additional assistance in order for you to get the help you need before you get to the final adjudication in a court of law. Since Mayor Levin was with us here, we want to highlight one of our many capital projects that was budgeted in our 2022 capital budget, which was presented last October, discussed and voted on by the Board of Legislators when we adapted our budget in December of this year. We're now in the process of implementing it. And we want you to know where the money goes, because you hear that magic word infrastructure all the time: roads, bridges, a host of other things, but it doesn't necessarily correlate the amount of money being spent to something of value. How does it affect me? And of course, wherever you live, something may not affect you because it might be targeted to a different part of the county. But in the aggregate, all of these capital projects are meant to benefit people somewhere across the stretch of Westchester County. This particular project is a $4.2 million capital project that improves our Ossining wastewater treatment plant. Now, wastewater treatment plant's another name for a sewage treatment plant or a sewer plant. There are 7 of them in Westchester County that are owned and operated by Westchester County. You'll see them in Portchester, in Rye, in Mamaroneck, in New Rochelle. You'll see them in Ossining, Peekskill, and in Yonkers. And each one of these plants are rather high-level technical treatment of sewage to treat them, to take as much of the poison out of it as possible, discharge the refuse in an environmentally sensitive way, and most importantly, so that people who live in these communities can function and work and can remove waste products from their everyday living. You wake up in the morning, you go to the bathroom, you're going to shower, you're going to shave, you're going to do whatever you do in the bathroom. And the waste products from that visit have to be treated and removed if we're going to have proper public health. So the $4.2 million improvement in the Ossining wastewater treatment plant is going to replace a twin feeder area cable. What that does is it raises the electrical transformers to make them resistant from flood mitigation. And all of our plants are located on bodies of water, either the Hudson River or a tributary or on the Long Island Sound. That is where the waste is discharged into once it's been properly treated. But they are all vulnerable to flooding. When the flood waters remain high, if the equipment of the sewer treatment plant doesn't work properly, if they get engaged by the flood, then they stop functioning. When they stop functioning, sewage backs up in your house. That is what you're trying to avoid. That is the purpose of spending $4.2 million in the Ossining district, and the Ossining district does not just benefit Ossining, but upstream other communities that are connected to that system. Westchester County has a tremendous need to prepare for storms that are much more frequent than the once every 100-year storm, as is often discussed. I have personally tried to argue to myself that when we talk about this is the once in 10-year storm, the once in 20-year storm, that's the wrong metric to use. These things are coming much more frequently, and you might have 3 20-year storms within a 5-year period of time. So just change the methodology. Call it a Category 1, a Category 2, up to a Category 5, just like a hurricane. A Category 5 hurricane is devastating. A Category 4, 3, or 2 has a certain footprint, and so should a flooding incident be, rather than trying to tie it to the number of years. That argument, however, doesn't change the fact that we're getting more flooding incidents everywhere in this county, and when it floods, it affects everything that's in its path. People know that it affects their personal home, maybe their business, their car. It can certainly cost them a loss of life. We lost 5 people during the Hurricane Ida incident back in the first part of September. But it can damage public infrastructure. And when it damages public infrastructure, the impact is on everybody, not just those who live near a place where water may overflow. If you live near a body of water, you worry about flooding. If you live in a low-lying area, water accumulates there, you worry about flooding. When it knocks out a sewer system, sewer treatment system, then it affects everybody in that area. And that's why we're investing the money. And the investment of the money is what has to be done on an ongoing basis. If you own a home, you know this. If you own a car, you know this. You do preventive maintenance on your home, on your car, in advance so that a crisis won't come and disable your car or cause the roof of your ceiling to collapse in your home. And that is what we're doing with this kind of allocation of money. And it shouldn't be treated as, oh, that's just business as usual. This is investment of money, tax dollars, that show foresight and the willingness to avoid the problem that doesn't happen because we planned on it, we knew it could happen, and we fixed things in advance. And that is why we spend this money on a twin feeder area cable. If you asked me to draw a picture of the twin feeder area cable, I could not do it. That doesn't mean that I don't understand why it's important. And it is important. And all of these capital projects are important. And we're going to highlight them for you each week so you get some idea of where your tax dollars go. Because it's not just the money you spend, it's what benefit do you get back from it. And in the federal government, when they talk about the multi-billion, trillion-dollar infrastructure program, what does that mean in real-world terms? What specific bridge that might collapse is going to be fixed by having this investment of money? What particular road surface that you're on that's bumpy that might collapse if this road wasn't fixed? That's what infrastructure is. And as relates to the sewer treatment plant, that's what we're doing in Ossining. And we're doing it for the people in that sewer district, but we have other projects in other parts of the county, and we'll mention it. We will not go on a full sewer tour of all the different sewer projects that we have, but you should know that our county Department of Environmental Facility is responsible for the operation of all of our wastewater treatment, management of water. It also is the department that collects the garbage that your local communities collect, and they bring to a transfer station. Then the County Department of Environmental Facilities takes it from the transfer station, brings it to Charles Point for final disposal. Also takes the recycling things that you set aside from your garbage. Those come to us, and those go to our material recovery facility. Those that have value, some of the metals, certainly aluminum and a few others, we gain some financial benefit from them. The rest we're able to dispose of in an environmentally sensitive fashion. The more recycling we have, the less impact we have on our environment, the more we lower our carbon footprint. And where the recycling product can be used again, we reduce having to create product from virgin sources, and we can protect those sources in there entirely for quite a while. These county treatment plants do vary in size. The largest one is in Yonkers by far, which treats the greatest amount of sewage, and the sewage system as we have it follows gravity and follows the existing water courses. So the Sawmill River, which exits Yonkers, then they had a big daylighting project where they opened up the mouth of the sawmill so that you could see what it looks like when it goes into the Hudson. The sawmill, as you know, the Sawmill River Parkway has sort of a diagonal cut through the county. So while it's identified with Yonkers and Greenburgh in the southern part of the county, it diagonal and cuts into places like Pleasantville, Chappaqua, Mount Kisco, Hawthorne and Thornwood, and the sewer systems follow by gravity that same route. Why by gravity? Because you have two mountains. There's a river in the middle. The river's the lowest part, and that's where gravity brings water and can also bring sewage down to the sewer treatment plant. The Ossining plant is on 4 acres in the village of Ossining along the Hudson River. It's near Sing Sing Prison, and the communities that are involved in this plan include the town of Mount Pleasant, the town of Ossining outside the village of Ossining, Briarcliff Manor, and Croton-on-Hudson. And there's quite a lot of that goes into this. There's some statistics here that I'm sure is not as interesting to you as knowing that it just works and that it takes the sewage out of your area. And if you live in Larchmont or Pelham Manor, you know that the New Rochelle sewer treatment plant just gets rid of the sewage. If you live in Rye Brook or Rye City, the Blind Brook plant takes care of it. And so this one as well is an important message. So we want to highlight that for you so you had an understanding. And we appreciate the mayor of Ossining being here. It was a good way to focus on this project. We'll be focusing on other infrastructure projects as we go along. We have a very serious moment that we're facing right now in our area. Just a couple of weeks ago, we made common cause with the Bronx when a devastating fire killed 17 people in the Bronx and made quite a large number of other people homeless. And our Westchester response was to put together a drive, as many other places did, to get goods and items together for those surviving families. And once again, we're called upon to look outside of our own borders for a moment of tragedy that is very serious. In the last few days, Officer Jason Rivera from New York City NYPD was shot and killed by an assailant. And police officer Wilbert Mora is in extremely critical condition in the hospital right now, fighting for his life. We want both officers and their families to know, Officer Rivera and Officer Mora, that they are thought of by their friends, not just in New York City, not just in the NYPD or in the police community, but by the general community at large. Both of these young men made the decision to go forward into a very difficult field, and that's the area of law enforcement and police work. And when you're in law enforcement, you put yourself between harm and danger and civilians. And that's exactly what Officer Rivera and Officer Mora did in responding to a call for domestic violence. A crazed individual who had an illegal gun was able to shoot both of those officers and took the life of Officer Rivera. The fact that the criminal paid the ultimate sacrifice and returned fire does not satisfy the fact that he obviously operated with some serious degree of mental instability and should not have been out in the public at large, and also that he had access to get an illegal firearm that he was not entitled to carry nor use. And these are policy areas that have to be dealt with as an outgrowth of that. That this happened over the dotted line in New York City gives us no comfort whatsoever. We grieve with those families, and we worry about the rising incidence of crime that we see in the greater society at hand. We in Westchester County, when we last reported on our crime statistics, which we did back last year, showed a decrease in violent crime in Westchester County, but nothing is ever permanent, and we have to work at it all the time. And this is as good a time as any to thank the men and women of law enforcement of Westchester County. The members of the Westchester County Department of Public Safety, Ken and I and Joan McDonald, go to the various graduating classes from the academy, the various promotion ceremonies. I think we haven't missed any of them. We've been there with the men and the women in blue. Some have transferred into the Westchester County Department from other departments, and we have a significant number, 40 other police departments that comprise the Westchester law enforcement community, the larger ones in the bigger cities, Yonkers, New Rochelle, White Plains, Mount Vernon, right down to the village of Buchanan and the town of Pound Ridge, which also have their own independent police departments. Westchester County does supply the local policing work on contract to the village of Mount Kisco, and then also we're partners with the town of Cortland. We just had a press conference last week to show the expansion of our operation there with the community resource officer. It's a very difficult time because the tragedy that occurred for police officer Rivera and the suffering that the Mora family is going through right now is a serious element of response for the police community, knowing that there are people out there who have no fear of assaulting a police officer or firing at a police officer. And that comes at the same time where just a couple of years ago, we looked at those police officers who acted outside of their proper behavior in the death of George Floyd. And we're caught in a position where we have to look at the situation as it honestly exists. And it honestly exists where there have been some police officers who've acted inappropriately, wrongly, and have committed crimes, and the vast majority of police officers who act properly, who show bravery, and who stand between us as civilians and crime, and to appreciate what they do, to reward what they do. And when these kinds of situations come, not only to grieve the tragedy that it's brought, but to try to determine how do policies have to change to make it less likely that an incident like this could happen. We're watching in a number of different areas crime rise. And there are people who will try to make political hay out of it on both ends of the spectrum. They'll try to say, well, if it wasn't for this, this wouldn't happen. If it wasn't for this, this wouldn't happen. We know intrinsically that there are people in this world who have evil intent. There are people in this world who will turn to violence for any number of reasons. Sometimes it's hard to imagine when and where it could be justified. In almost every case, it's an expression of their anger and their misdirection of the things in their life that have led them to this point. It's not for me to psychoanalyze them. But the man who pulled the trigger and shot these two police officers has no quarter with me or any of us who want to see police reform. We want to see the proper support of our police department. We want to see our men and women in blue properly treated, properly cared for, so that they can go out and do their job. And we want to correct the mistakes or the errors that do exist in those situations. Those are not mutually exclusive. And this is not an either or. And this is not a, you either back the police or you back criminals like this man that pulled that trigger. It's important for us to think through where we are in this moment, be very clear in our minds about what we're dealing with. And in this particular case, we have to do everything we can to deal with the fact that in this society right now, for whatever reason, there is a greater individual willingness to do whatever advantages the individual. I don't know quite how that's happened, but it has happened. When you see somebody driving aggressively, we talked about that, aggressive driving, somebody who goes outside the bounds of normal, courteous driving and risks another person's life, the way they change lanes, the way they speed, their behavior. You watch people who act out in public settings and express their anger over something as if their anger justifies their behavior or their unwillingness to follow basic rules that are structured for society. We don't create rules to rule over you. Some people want to interpret it that way. But those rules exist in order to have an appropriate civil society where we can live and grow in peace and harmony. And some people find that aggrieving to them, and they decide to act out with a moment of anger, misdirected anger. And when that anger reflects violence to another individual, they cross that line into criminality, and that criminality has to be dealt with, both in the way they are dealt with and then in the way the criminal justice system adjudicates the rightness or the wrongness of their case. It's a very complicated world we live in. What is simple is that Jason Rivera and Wilbert Mora were doing their job. They responded to an incident where they believed a civilian was potentially endangered by the actions of somebody else, and they went to protect that civilian, and they wound up being shot, and one of them has lost their life, and the other's fighting for their life while they were defending us. And that is something that everyone in this society of right thinking feels pain and feels their suffering. And we need to do more than just feel pain and suffering. We need to do things to support that so that those officers who are out on patrol, even as we speak right now, believe that they will have that support. We funded in this county budget $52.8 million to fully fund our county police department. And the debate over how much money you fund a police department is really focused on how you use that money, and we felt the money is used wisely to help protect the people of Westchester County. At the last time that we took a look at this, 5-6 months ago, the numbers look good. We don't know where the numbers are today. And around any corner, anything can happen. But it's important to understand the balanced view of these things. We must reform the things that are wrong, not just in policing, in everything in our society. We have to reform the mistakes that we have in environmental protection. We have to reform the things we have to do in order to make sure that people have an opportunity for housing. We have to reform the things we need to do to make sure that we have proper education. But at the same time, we have to have civil order. We have to have a rational system of law and a rational system that polices those laws so that you and I can come and go with a confidence in the way we live our lives. That is not liberal. That is not conservative. I view that as being universal. And universally, whatever our faith traditions are, or if we have no faith tradition at all, but whatever our traditions are, put these two men in your thoughts tonight. And if you do believe, as I do, in an Almighty, pray that Police Officer Mora will rally and will be with us again, and that Police Officer Rivera has that eternal peace that we hope we all reach when we reach the end of days. If there are any questions, there are no questions from the press. If anyone has any questions from the press thereafter, feel free to call Catherine Chaffee, our Director of Communications, at 995-2932. She'll be happy to answer them. Ken and I will be back next Monday, God willing, for another 2 o'clock update. We'll have another one of our municipal partners joining with us today at 3:30 today. It's not a public conversation, but we will have another one of our conference calls with the various elected officials from the municipal governments. We'll go over some of the issues we covered here, then some other detailed issues, so we keep this going. We are trying very hard, as imperfect as we are as people and as imperfect as we are in government, to show the cooperation between different levels of government so we can address the problems that we have in a society. Nothing more than that, but nothing less than that. I'm George Latimer, County Executive. Thank you for watching. Have a good, safe day, and we'll speak to you within the week.